Hello, and thank you for viewing today's presentation entitled Multiple Sclerosis and Hair Loss. Now, this subject was actually suggested to me by a subscriber, I believe to my YouTube and my Facebook pages, named after me, Stephanie Anderson. And I want to thank you for the suggestion. So here goes. I hope this information, Tina, is helpful to you and the other viewers. So for those of you who may not know me, my name is Stephanie Anderson. I am the resident trichologist and hair replacement specialist at Trinity Lace Wigs here in San Antonio, Texas. I'm also the hair replacement coach. I'm a speaker and an educator. So without further ado, let's start this quick presentation. Okay, so the request was made to talk about MS or multiple sclerosis and hair loss. So to clarify, I'm going to briefly discuss whether or not hair loss is an effect of MS, and I think that is what I was asked to talk about. At least I hope it is. If not, I'm sure Miss Tina will let me know. She's a very nice person, and I finally had the opportunity to meet her a couple of months ago. So anyway, I digress. Okay, so is hair loss an effect of MS? Now that is an excellent question, especially since hairstylists, barbers, and beauty professionals everywhere are servicing clients with multiple medical diagnoses, and MS or multiple sclerosis is one I am sure will be seen in your chair. That is, if it hasn't already, and you need to know this information. So first, I guess we'll find out what multiple sclerosis or MS truly is. Now, if you have a client that lists MS on the list of diagnoses during a consultation, what is it? Well, the definition of multiple sclerosis is an unpredictable, often disabling disease of the central nervous system that disrupts the flow of information within the brain and between the brain and body. Now, that sounds like a simple definition, doesn't it, for such a complex problem? So let's find out what causes multiple sclerosis. Now, the nerves of the central nervous system, or the CNS, are protected, and they're insulated by a fatty sheath called myelin, which helps messages or impulses travel to and from the brain. Now, when one part of the myelin sheath or nerve fiber is damaged, such as by MS, transmission of the impulses may be distorted or interrupted, which means that important messages are either not reaching or being sent out from the brain. Now, the fatty sheath or the myelin is attacked by the immune system, which are scars from the central nervous system called sclerosis, which gives the disease its name and causes the MS or the multiple sclerosis symptoms. Okay, since now we understand what MS is, now we can discuss how it relates to losing hair. Now that's why we're here, right? Okay, so one of the causes of multiple sclerosis hair loss is the use of interferons to treat some of the symptoms of the disease. So I believe in actuality, it is not necessarily the disease itself. However, the medications used to treat it. So you may be asking, what are interferons? Well, Wikipedia defines them as a group of signaling proteins made and released by host cells in response to the presence of several pathogens, such as viruses, bacteria, parasites, and other tumor cells. In a typical scenario, a virus-infected cell will release interferons, causing nearby cells to heighten their antiviral defenses. Now, the impact of the interferons is not instantaneous. Some patients use interferons for an extended period of time before they even notice that their hair is thinner than it once was. That is when it will occur to them that they are experiencing hair loss. Now, if they're lucky, they will be able to quickly make the connection between the interferons and the hair loss. But if not, they may take a long time to make the connection, or they may never make it. Now, interferons can make the hair more vulnerable to breaking by changing its texture. Thus, any efforts to comb or brush the hair might even break it. Even the fabric out of which the pillowcase is made might increase the likelihood of hair breakage. Interferons can also trigger alopecia, which is the form of hair loss that occurs when hair drops out of the follicles spontaneously. Now, this happens among some MS patients who have used these drugs for more than 3 months. Now, fortunately, this kind of hair loss does not have to be permanent. Discontinuing the medication upon a doctor's recommendation allows the hair to start to grow back after some time. Now, occasionally, some patients grow back the hair loss even when they are still on the interferon. In these cases, patients are fortunate that MS and hair loss do not have to be permanently associated. Now, interferons are not the only possible cause of hair loss. Multiple sclerosis and hair loss coincide in some patients when they suffer from, now get this, tremendous amounts of stress. Other MS patients experience hair loss because of thyroid disease, which may or may not be associated with the progression of their multiple sclerosis. Now, the connections between thyroid disease and multiple sclerosis have been attested to in some studies. For instance, one study has shown that MS patients have greater than average vulnerability to other autoimmune disorders, including thyroid conditions. Now, another study has shown that supplementing the body with thyroid hormone during certain phases of MS can help prevent some new damage and can also facilitate the repair of tissue that is already damaged. Among those MS patients who are suffering from thyroid abnormalities, thyroid hormone supplementation might offer a great solution to their hair loss. Now, I believe it's emotionally challenging for someone who is losing their hair. Now, I see it every day in my hair treatment center here in San Antonio, Texas. And as a professional, there are things that you may be able to do to assist your client who is losing their hair to medically related reasons. Now, depending on the severity of hair loss, once a person takes steps such as maybe wearing a wig or covering to feel more attractive, their self-esteem may improve. However, I would like to offer a few additional tips on dealing with this hair loss. Now, if the doctor says that their hair loss is likely falling out due to medications, inquire whether your client wants to wear a wig. You may want to shop or have them to shop before treatment to match their hair color. Or hats, turbans, and scarves can also camouflage hair loss, although some people prefer their heads uncovered. Also, cutting their hair short. It eases the inconvenience of shedding lots of hair, but it also can reduce the emotional impact of extremely thinning and hair fallout. I would also suggest to minimize perms or colors on your client's hair secondary to any medication hair fall. Those chemical treatments are already damaging to hair and can enhance the hair loss. You can also make sure to cleanse the hair with a shampoo that is SLS and detergent free. Always remember to use products that are known to be more gentle on the hair. Okay, so I promised that this presentation wasn't going to take up much of your time, so I hope this information helps you to understand hair loss as it relates to multiple sclerosis. I want to thank you for viewing this presentation. Also, keep the suggestions coming. Remember, if you ask, I answer. So this is Stephanie Anderson from StephanieLAnderson.com. Thanks for viewing. So for more information, you can always contact me at info@StephanieLAnderson.com, or you can visit my website at www.StephanieLAnderson.com. More hair. Be blessed, everyone. Bye.